Hello, this is Group 7, and our topic for today is the social menace of drug addiction. So, people have always been curious about the world, and some have the tendency to experiment with anything and everything so that their life is better and comfortable. Scientists have discovered that remedies can treat pain and illnesses and promote good health and longer life. In ancient Egypt, their physicians prescribed berries such as figs and dates mixed with castor oil as their laxative. However, in Chinese and Greeks, they used opium for its pain-relieving properties. And Hindus resorted to cannabis and henbane leaves as anesthetics. In our modern society, drugs treat medical and psychological disorders. It determines whether a substance is a drug. One must know its uses, for example, alcohol. Alcohol is a beverage, but is also considered a drug, used for relaxation, removing inhibitions, and stimulation of appetite. In 2004, Coloma and Herrera state that drug dependence refers to the overuse of a drug without due regard for medical practice, thus resulting in an individual's physical and mental and emotional or behavioral impairment. According to the Drug Enforcement Agency, also known as PDEA, our clinical definition of drug is that it is a therapeutic substance other than food used in prevention, diagnosis, alleviation, treatment, or cure of diseases in humans or animals. In our general definition, however, drug is a substance aside from food intended to affect the structure or function of a physiological system such as the human body. However, we come to know drug by its popular definition. It refers mainly as to chemical or plant-derived substance that affects the body's psychological behavior or physical function, which leads to varying degrees of dependence or addiction. So now we will be talking about addiction. Addiction means not having control over doing, taking, or using something until it becomes harmful. It also means having a difficult time without it during the day. Commonly, there are dependencies on alcohol or drugs, but one can also be addicted to other things, such as gambling or chocolate. So, for my trivia question. Number 1. What drug did the Chinese and Greek use for their pain reliever? Number 2. What drugs did the Hindus resorted in using?
So now, I will proceed with the next part of our report, which is about the classification of drugs and marijuana. So first, classification of dangerous drug. According to the Dangerous Drug Act of 1972, dangerous drugs are classified into two, which is the prohibited drugs and regulated drugs. So the prohibited drugs, this includes drugs that produce psychological effects and narcotics that relieve pain and include sleep. Example, cocaine, LSD, opium, and its derivative. These are substances may cause strong changes in behavior, perception, and brain function. So, regulated drugs. These include sedative, self-inducing, and hypnotic drugs such as barbiturates and amphetamines. These are usually used for medical purposes but can still be dangerous with abuse. According to the Republic Act 19165, drug abuse involves using illegal substances, but even prescription drugs can be abused if they are taken in the wrong way or wrong dosage. Even medicine from a pharmacy can be harmful if misused. Common drug type is marijuana. According to the National Institute on Drug Abuse, marijuana is a greenish-gray mixture of dried flowers of the cannabis sativa plant. It is also known as weed, herb, grass, and many other slang names. It can be smoked using joints or pipes and blunts. So these are the adverse effects of marijuana. So first is impaired memory and short-term thinking skills including reading, math, and comprehension. Poor motor skills which can lead to accident and increases stress for respiratory illnesses like lung cancer, higher risk of neonatal problems such as miscarriage, early childbirth, low birth weight, and newborn death. Increased anxiety, panic attacks, and paranoia for some users. A motivational syndrome, loss of interest, lack of motivation, and dulling of the mind in chronic users. and fatigue and apathy, feeling tired and not caring about surroundings. 7 is weakened immune system, making the body prone to infection, and decreased sperm production and abnormal sperm shape or movement, and lower testosterone levels, especially risky for preteen boys and may cause temporary infertility, syndromes of mental illness, especially when you use regularly or excessively. So, how to avoid marijuana use? A person can avoid or recover from drug use by asking help for family, friends, or healthy professionals, discovering talent and focusing on personal growth, building healthy relationships, learning new skills, using healthy coping mechanisms instead of harmful ones. So, dangerous drugs, whether prohibited or regulated, can have serious harmful effects on the body and the brain when abused. Marijuana, although common use, can lead to multiple physical, mental, and social problems. It is important to choose healthy coping habits and seek support when needed. So, for my trivia questions, what syndrome refers to losing motivations and interest due to frequent marijuana use? Number 2, what are the two classifications of dangerous drugs according to the Dangerous Drugs Act of 1972?
So, crystal methamphetamine, also known as shabu. So, methamphetamine in the Philippines is very common among locals. So, shabu is highly addictive stimulant that affects the central nervous system. So, kuan siya, it usually appears a white, odorless, crystalline powder that dissolves easily in liquid. So, shabu is commonly used by inhaling vapors from heated crystals, pero pwede siya ma-ingest or inject. It remains widely used in the country, often smuggled by drug syndicates, with some local laboratories also reported. So, adverse and physiological effects. So, short-term use of methamphetamine use causes first, increased attention and wakefulness, pero may magsiga ang mata sa user. Hindi siya katog, pero may magmata. Next, decreased appetite. Hindi ka siya makaon or hindi na siya makaon mo nang makita na to mostly sa mga drug users kay mga daot kayo. Next, euphoria and rush. If rush, pero magdali, agitated. Euphoria, state of happiness sa ilang kaugalingong kalibutan. Next, abnormally fast or irregular heartbeat. So, ilang dughan, pero mas kayo ang dagunog sa ilang heartbeat. Hyperthermia, opposite sa hypothermia. Hyperthermia, initi sila. Next, convulsion. Next is the long-term effects of the shabu misuse. So, according sa National Institute on Drug Abuse or NIDA, long-term methamphetamine misuse can lead to psychosis, including paranoia. Una sila makapatay sila tungkol na paranoid sila, hallucination, imbis makita nila tao, makita nila mga demonyo according sa mga reports. Next, repetitive motor activity. Next, changes in brain structure and function, deficits in thinking and motor skills. Wala silang pangunahuna o ilang linihokan, wala na sad. Next is increased distractibility. Distracted sila always sa ilang surrounding, that is why paranoid. Next, memory loss, makalimot sila. Dahil kahit lang makalimot silang ibuhat or whatever happened. Next, aggressive or violent behavior. Ang sige gamit siya aggressive kay sila and mag-ibit sila og violent behavior towards sa other people. Next, mood disturbances. Sila dali na kay masuko, mawa sa ilahang mood, muna makapatay sila or unless makaharm sa laing tao. Next, weight loss. Muna na yung katong connect siya sa decreased appetite. The longer you take shabu, magpakita gid ang iyang effect, weight loss. Siya makaon, always mo daot kay siya bermi. Makita siya yung mata, siga yung mata tungod sa walay kaon. Next, higher vulnerability to various illnesses. So, muna na, mga sakit. So, next topic could be inhalants. So, inhalants are volatile chemical substances found or makita sa tuang household products. Example lang ni kay acetone, glue, gasoline, hairspray, spray paint, and other chemical products nga or cleaning products. Next, if imong inhale or yes, inhale, the psychoactive vapors produce intoxication, meaning mahay ang gamit ani. So these substances are often misused because they are accessible and inexpensive. Ato pa barato ug dali ra makita sa atong palibot. So mao ni ang dangers of inhalant abuse. First, makakause siya og permanent brain damage. Next, may lead to sudden sniffing death syndrome. Katulo, users are prone to accidents and drowning, falling due to impaired. So balik to sa sniffing death syndrome. So unsa man ni? So ang sniffing death syndrome ay tabo ni siya if ang nagamit maabot into cardiac arrest or heart failure if abuse nila ang inhalant. Primary kay lack of oxygen ma-reach sa iyang heart. May tabo ni siya if first time gamit sila sa inhalant or ilang i-abuse o gamit. So next, maka-trigger siya og violent behavior. Next ang immediate effects. First, confusion and disorientation. Distorted perception of time and distance, aggressive behavior na pod or violence, kaupat, hallucination, or same ra siya o effects sa shabu or the crystal meth. Next is ang delayed effects. If magamit ka ani from time to time, mo appear rin siya nga effects. First, loss of memory, inability to think, di na ka makaunaw ng tarong, muscle cramps and weaknesses, numbness of limbs, abdominal pains, and damage to the CNS or the central nervous system, the kidney, liver, and sometimes ang ato ang bone marrow. So, ang one such example sa ato sa Philippines, kaya sa na may shabu or drug pushers na si drug users sa shabu, ang example sa inhalant sa Philippines commonly is ang mga rugby boys o also known sa mga street boys na sa Philippines. So rugby boys sa mga common siya sa mga street children nga magamit og rugby or adhesive, contain siya ang rugby nag-contain siya og chemicals nga mag-produce sa intoxication making sa ang magamit ani inhalant abuser. So trivia question. First trivia question is for the crystal meth or the shabu. So what is the common street name for crystal methamphetamine in the Philippines? Nga nag-resemble siya og rock candy or chips of ice. Next is the second trivia question. So what is the dangerous condition can occur suddenly during inhalant abuse, leading to instant death even after single use? Di-discuss ni, kung nag-discuss, di balik na ako ganiya sa about inhalants.
So now let's move into ecstasy. Ecstasy, also known as methylene dioxide methamphetamine or MDMA, XTC or ADAM, or eating tablet. As a designated drug similar to amphetamines, it's known for its stimulant and hallucinogenic effect. Pure ecstasy is a salicylate white powder, but it's typically sold illegally as tablet, capsule, or powder and taken orally. So there are danger of using ecstasy. First, development of depression-like feelings. Grabe ang pagka-depress and anang feeling like super down. Then second is anxiety. They have this feeling na mahadlok. Third is restless. Wala na sila ipahulay. Fourth, irritability. Like grabe nilang pagka-irita sa magagmayng butang. Then 5, sleep disturbance. Wala na sila tarong yung tulog. And there's also immediate effect. Euphoria and well-being. Second, empathy and sociability. Third, heightened sensation. Fourth, lowered inhibition. Fifth, alter perception. Next, opiates or narcotics. What is opiates? Opiates, sometimes called narcotics, are a class of drug used medically to relieve pain, but have a high potential for abuse. Some opiates are derived from the resin of Asian poppy seed pulp. Commonly abused opiates include opium, morphine, codeine, and synthetic opiates. Opiates are depressant that slow down communication between the brain and the body. The opium poppy, or Papaver somniferum, is one of the earliest plant recorded in medical use. There are dangers of using narcotics. Regular use of prescribed medication can increase a person's tolerance and dependence,
requiring higher and more frequent doses. In addition, opioids can restrict the ability to breathe when taking a higher dose, and when misuse can lead to a fatal dose. There are also immediate effects. First is drowsiness. Second, nausea. Third, confusion. Fourth, constipation. Next is cocaine. Cocaine is a stimulant drug derived from the leaves of Erythrocylum coca plant, a drug native to South Africa. It affects the central nervous system, suppressing appetite and producing euphoria. And increased energy, cocaine is a quick-acting drug, but there's also the danger of using cocaine. It altered consciousness, impaired memory, disinhibition, euphoria, and attention, altered judgment. And there's also immediate effect. First is aortic rupture, arrhythmias and sudden death, stroke and hemorrhage, heart attack, and chest pain. Question number 1. What is the medical name of ecstasy? Question number 2. In what leaves does cocaine drug came from?
So let's talk about sedative. So sedative, hypnotics drug, tranquilizer, and sleeping pills are drugs that depress or slow down human body function. These drugs are dangerous when taken without a medical doctor's prescription or supervising physician. So the primary purpose of sedative is to calm and relax the body. And the primary depressant, which part of the body is the central nervous system. So next is steroids. Steroids is anabolic commonly contain male sex hormone, are the substance being orally taken or injected usually by people who want to be buffed and to be strong, especially in physical aspect. And so the steroid primary use is reduce inflammation, and for long-term use of steroid can cause moon phase. So next is tobacco. Tobacco is often smoked in form of cigarette or cigars or chew. It is contain nicotine, which is stimulant and a highly addictive substance that has been known to cause cancer and other diseases. So the most affected is the lungs, and smoking is leading to cause lung cancer. My two trivia question is, what parts of nervous system do sedative primary slow down? Number 2, which organ can be damaged by long-term misuse of anabolic steroid?
Thank you to our previous reporter. Now let's go talk on nicotine. Nicotine comes from the harvested leaves belong to the plant group nightshade. This is what gives the tobacco its anti-resistant effect to people that they make their brain crave for more and more nicotine. This pleasure and sensational effect puts them under high risk of developing diseases such as buildup of plug within the blood vessels that causes it to constrict or become narrow, and inflammation of airways that impairs our breathing, leading to shortness of breath or much worse, lung cancer. Next is the reasons of drug abuse. Number one is curiosity. This is when a person sees her friend frequently smoke, our minds begin to wonder or have an interest of what it feels like to smoke and how our body responds when it receives the effects of nicotine. Next is influence of friends and peers. This is commonly the reason why a person is prone to smoke, but it depends on him or her and how he counteract the way his friends convince him to avoid smoking. Effects of ecstasy increase confidence and energy. Once the nicotine reaches the brainstem, the receptors will begin to bind. Once it binds, it triggers and releases the surge of hormones. These are dopamine, which keeps us motivated all throughout the day. Next is adrenaline that keep us stay alive and alert on the tasks we do. And lastly is serotonin or endorphin, which plays a crucial role in mood regulating, which keep us irritable or become passive. Next is the signs of drug dependency. Number one, number one is mood swing and explosive outbursts. This is not 100% sure, but it can be influenced by different kinds of reasons or factors like stress from lots of paperwork or documents from school, work, or at home, then having a quarrel with your family member or financial problem that you couldn't support your daily living. Next is staying late at night or not coming home. This can be due to several reasons that is unrelated to drugs, like going out on the bar with your friends, then being drunk, dizzy, and so much headache, unable to go for a long walk or ride towards home, then preferred booking a hotel for the rest of the night and going home early in the morning, or having a group work that you need to stay in your friend's house for you to complete the project as it would be passed by tomorrow. Next is unreasoned need of money, sudden loss of money and valuables. Today, since nicotine or tobacco comes with a vape, a product with a different flavor, one it does not meet the taste of that smoker, they will highly buy a new one that is in a high price. Then they don't have enough money to buy, and by the time they ask their mother for money, they're hesitant, for they know that their parents wouldn't allow them to spend such money for these things as it would not impact their schooling towards success in life. Next is less extracurricular activities, social withdrawal, minimal contact of parents, especially to those parents that are very strict and value the things their son doing in making them a responsible and disciplined individual in the future, and also the fear being grounded or not able to take these kind of products as our brain is also dependent on it and scared of not being supported by our parents. Next is changes in sleeping pattern. Earlier I mentioned once the dopamine stimulate our brains, we stay active even late at night, which could possibly during the day we feel sleepiness, the effect has already fall off. Next is changes in eating pattern. So once we change in eating pattern, the nicotine binds on the extra receptors on the neurons, which triggers sudden feeling of fullness, making us keep eating, invest more on fats rather than vegetables and fruits. Next is loss of motivation lethargy. Since our feeling or strength to do some work as we feel numbness or weakness in our body. Next is glassy eyes. Some drugs as alcohol can overstimulate our thyroid glands, which lead to us to have this kind of appearances in our eyes. Next is deterioration of physical appearance and grooming. Since, in what I have said earlier, the decrease of dopamine, having an adequate or inadequate sleep, keeps us have a appearance of line streaks on our face, make us look old, and the tiredness also influence us to make us unable to present ourselves decently to the people around us. Thank you in behalf of my fellow reporters. Thank you, keep safe, and God bless everyone. And also important to note that whenever we see a person having such addiction, it's also best to consult them with the different organizations that medicate or mitigate this kind of alcohol uses right in our age, and counseling them under our school premises to save themselves from having diseases and be healthy. Here's our trivia questions of the day. Number 1. Is nicotine addictive as switch to other substances? Number 2. What specific hormone released by nicotine that make us feel so good? So that's it for our trivia of the day. Once again, I'm calling you Mangyao, and on behalf of my fellow reporters, We especially and genuinely express our thanks of listening us and bearing your time with us. Once again, thank you, stay safe, and keep healthy.